Hi, I'm Jackie Rabbit. Let's talk about surgery. I've had quite a few surgeries in my lifetime, and I know that some of you are quite worried about surgery. You've never had one before. This will be your first surgery if you have it, right? And you're worried. What will that be like? Well, I'm going to tell you all about surgery. I don't know anyone else that's more qualified than myself because I've had so many. So, I want to talk to you about that and reassure you what my experience is so you can feel better about what's coming. Remember to thumbs up this video, go subscribe, and click the little bell so you know when I post a new video. Let's go talk about what surgery is like and how you're going to get through it just fine. Come on, let's talk about it. Surgery is kind of scary when you think about it, and it's kind of a stumbling block for some of us. But I'm going to share with you my experiences so you can understand what it's like if you've never had a surgery before and you're coming up to the idea that you need to have one. And I know you're worried. So if this fits you, follow along with this video and I'll go through the details I've experienced. So why am I so qualified to tell you about surgery? I've had more than I can count on my hands. Some of them were life-saving, some of them were reconstructive, and some of them were trans-related. So I've got quite a bit of background on the surgery forefront, and I'll share with you so you understand what the differences are between an unplanned surgery and a planned surgery for your reassignment. I know there's lots of terminology these days, but I'll use the ones that I see most in comments because it seems that those are the people who are asking me the questions. So if you have left me a comment before and said you're worried about surgery, or you don't know if you can have surgery, or that it's been postponed or put off, well, don't stress. Breathe in and breathe out. This all takes time no matter how you look at it. There's a lot of preparation that goes into it, and a lot of that preparation has less to do with you physically than it does mentally and your schedule. So I'll start off with the surgery experience I had earliest. So I was one of those people who never even had a broken bone. Nothing. Like, I just got super lucky all my life and I never had any problems. I never even had a cavity. Broken bone. Nothing. I had like a sprained finger once. I got hit in the head with a soccer ball during a soccer game. That's kind of it. So, pretty lucky there. Here's the thing. About 16, 17 years ago, I was riding my Ducati 900 SS. Gorgeous motorcycle. Sounds like riding a stereo, just musically stereo exhaust, and beautiful. But anyway, I was riding it with a pack of about 30 other people, and we were just putting around. This was a group that I went with on a regular occasion. It was actually a Yamaha club, and a good friend of mine was in it, and we'd go riding now and then. And I wanted to break in this brand new, gorgeous Ducati I got, and I was really excited, an exotic Italian bike, and it's nothing regular, normal, 748 or 916, which I do love those, but it was a 900 SS with the really swoopy bodywork, and it was black, like a Dracar bottle, And I was going to paint the wheels red, and then I was going to do like red, green, and white and stuff because I really like the Italian theme. So anyway, I got hit badly, really badly. I don't remember it at all. So I died on the scene. I was put in a helicopter and revived. I remember 10 seconds of audio inside the helicopter where they told me what happened, and I told them one thing, that I really wanted them to tell my wife that I loved her and that I was very, very sorry, because I kind of knew I was done. I'd been broken in half. My pelvis had come off my spine. My pelvis had snapped open. The right leg below the knee had pretty much internally decapitated itself. The bones were all out of my wrist and out of my arm, and it was bad. It looked like I was going to lose limbs if I lived at all. But I did get through it, and the surgery experience will be the first one I share with you. I spent a week in the ICU, and I was pretty much in a coma. And then finally I started waking up enough and remembering what was happening that when they told me what had happened, I retained it. But apparently that was going on for days, and they were getting a bit exasperated with the idea that I kept asking the same question. And eventually I did start remembering. And it was very, very scary in that ICU. And I was fighting for every breath when they took me off the ventilator. And that went on for days. They really weren't sure if I was going to make it. You know, most people snapped in half don't. I had many surgeries, wrists, pelvis, a full reconstruction, all sorts of stuff. And then later they had to go in my knee twice, and then hernia surgeries up here and down here. And it was so much stuff over the course of years. And I was in the hospital for 3 months, which is horrifying. It's almost like a jail sentence when it's like that. It's just, you get depressed and stuff. It's really bad. So that was an emergency, unplanned, life-saving experience. Was it scary? Oh, yes, it was very scary. Did I live through it? Oh yeah, I lived through it. So here I am. Can you live through it? Yeah, if you had all the things happen to me that I lived through and the things that were done to help save my life, you'd probably live through it too. And you do get through those things because you don't really have a choice. You're just along for the ride. Now, how does that compare to any of the surgeries I've had for gender reassignment? It doesn't compare even in the slightest. There is no comparison at all. So, I have had facial feminization, I have had vocal surgery, I have had breast augmentation. So those 3 so far. And 3 months from now, I will be having the downstairs work done and we'll remodel the basement. So that's coming. Am I worried about it? Yes. But why? What am I worried about? Well, I'm worried to get all my stuff done at work. I'm worried that the things that need to be done while I'm out of commission are handled. I want to make sure my coworkers aren't unduly burdened. So that's what I'm worried about. The surgery itself, I'm actually really looking forward to this. I'm looking forward to every possible aspect of this experience. And I want to soak it up, memorize it, and remember this because I get to do this one time. I'll document it the very best I can. I have a box full of HD cameras, batteries. I ordered extra batteries. I'm getting extra memory cards. I'm recruiting everyone I know. And I may even get a professional video crew to document the whole thing. But I don't know if I can afford it yet. So I'm trying and see what I can do about that. So those 3 surgeries do not compare in the slightest to the emergency surgeries I had to go through just to survive. So what was that like? Well, let's start with the easiest one. The easiest one was the vocal surgery. I went down there, I got ready. I walked into the OR, joked with everybody, laid down, had a nap, woke up with a sore throat, went home. Really, that's what it was. My dad came and got me and hung out, had a hot dog for lunch, and we went home. And then I was supposed to not talk for a week. I won't admit whether I did or I didn't. But I did sneeze the first night and blow the stitch straight off the vocal cords. My fault. I just bang, sneeze, and I knew immediately it's off. Talked to the doctor, she looked, yep, you blew it off. Well, schedule it again. So a week or so later, I'm back. Same process. I'm actually having more fun now because I'm joking with everyone. I'm like, well, I hope the second time's charm. So, and it was OR2, and I'm like, oh, OR2 for second time. Awesome. First one was OR6. I don't know why. I like 6 though. And that was that surgery. That was the easiest one. In, out, simple. The inconvenience of not talking is really the thing. You know, people want to ask you how you're doing and you can't answer. The second easiest surgery was breast augmentation. Again, that was the first gender reassignment surgery I had. And I did have a little bit of anxiety when I was in the parking lot. I felt like a tiny bit right in the center of my chest. And I even told Dad, and there's a video about that long ago where I talked about it in the car. Oh, I feel a little anxiety, you know. And then in the waiting room, it took a while, and I felt it again, but it was a little. It wasn't a big deal. And as I laid down and waited, and they had me prepped, I felt one more time a little anxiety, but I think it had more to do with the fact that this was my first surgery after all of the motorcycle wreck surgery, and my mind was trying to compare the two, and I didn't know what to expect. So that's what worried me more than anything. And that's where I think you might be having this struggle. You've never had a major surgery, and you don't know what to expect. That's why I want to share this with you, so maybe you get it a little bit more than you did before. So the hardest one so far, although I don't want to call it hard, the biggest surgery so far was the facial feminization surgery, where they reshaped the bones in my forehead. They did a brow lift, they brought down the hairline, and they did a lip lift, all in one surgery. I didn't really need any jaw work. I do need like a little bit of a facelift. It would be really nice. Oh, I would love an SMAS facelift. Oh, I would love that so much. I will get one. They are $15,000 at Kaiser, and I'm saving my money. So I'm going to go do that as soon as I can. I don't know if I can do it this year, but I will try, and I'll take you with me. It was a big surgery, and it took me a good solid week to really feel human again. My head was really swollen, and the first thing I said when I woke up was, I have a headache. And that's actually in another video. If you go back and look at my video on having FFS, that's exactly what I had said. It was on the video. My dad was taking video, and he's like, how do you feel? And I said, I have a headache. So, that was my experience. The most inconvenient part of that was all the stitches had to be gooped up with Neosporin or Polysporin all the time, and it gets in your hair, and it's just such a mess. Eventually, I realized you could use clear dish soap, like clear Palmolive dish soap, and finally get that out of there. But it took me another week of washing my hair, once they would allow me to do so, to really get it out of there. And then a few weeks of being really careful around all the stitches that went back here, back on my head, way all the way back here, and all that kind of stuff. And then after a month, I felt pretty good. I had a numb spot right on top, but that, I'm good. It's back. I don't have a numb spot there. It feels ever so slightly different, but not a numb spot at all. It's fine. So maybe there's a loss of sensation, but it's the top of my head, and I don't seem to care. So the difficulties with that were initially, I was laying flat on my bed instead of sitting up. Or I wasn't inclined enough, and my head got pretty swollen. I was taking a nap at work in a recliner, and the stitches started pulling tighter and tighter, and I was swelling up. And so Dad and I thought, well, maybe we should go get this looked at. I went to the emergency room, they looked at it, and I sat there straight up for a while, and everything started draining. So I was fine. I went home, and it was no big deal, really. So after that, I learned not to panic about little details like that. Nothing was wrong. I was worried the stitch would pop, and it was right here in the corner of my nose at the lip lift, and that worried me. But ultimately, nothing bad happened there, so it was fine. And I got through that. Before the surgery, I wasn't stressed out in the slightest. I already knew what to expect because I had gone through breast augmentation. So FFS was my second surgery, but since I had a frame of reference, I knew I wasn't worried. It was no big deal. And then there was, of course, FFS, or VFS, vocal feminization surgery, and that did not go according to plan. But then I went back, and they worked it up again, and they were very, very careful, and I got reasonable results with that. My voice is rather unique, and there's nothing wrong with that. It's a little husky or whatever, but decidedly female, so goal achieved. That's the way that works. So I shared as much as I could think of right there, and I want you to know that if you have surgery coming up, or you have to decide about whether or not you're brave enough to have surgery, trust me when I tell you, you certainly are brave enough. You certainly are brave enough. So I don't want you to worry. I want you to know you can do this. It's not life-threatening. You're not going to die. You're not even going to get hurt, really. There is some pain. Are you worried about the pain? Well, let's talk about pain. Pain is very subjective. When you have a planned surgery, pain is managed. From the moment you get out of surgery, you're already flooded full of pain meds. And they give you pain meds. And it's managed and carefully thought out. So there's no need to worry about it. I actually hardly used the, the codeine they gave me. Or maybe it was Vicodin, I think, actually. And I maybe took a few after FFS, but the rest of it was Tylenol. I really didn't need the pain meds, the big heavy stuff. It wasn't as bad as you would think. Not having a frame of reference for pain sometimes is difficult too because you worry. And if you worry and you tense up, it does make things worse. So my best advice to you is develop some relaxation techniques, some meditation techniques where you seriously just relax every muscle in your body. Just let them all completely slack. And do that for 15 minutes at a shot. Because if you can do 15 minutes of full relaxation, no thoughts in your mind, just a blank slate mind, you will actually be able to manage pain in a way that doesn't require pain meds. And I know that because I've practiced this for the last 15 years. And it truly works. I want you to know you're going to be okay. Don't be scared. Do not worry. Do what your doctor tells you to do. Follow the instructions they give you. Don't stress out about the little details. Don't worry. Just remember every detail for yourself. This is part of your journey. This is part of what makes you, you. The things that shape you are the challenges in your life you overcome. So make this challenge something that shapes you in a positive way. You can do it. I have faith in you. Remember, I really care about how this goes for you, and that is why I share. Remember, one more time, I'd love a thumbs up. Please go down there and make some comments. If you've already had a surgery, let people know how it was. Explain to them it's okay. Let them know a little of your experience so they can see one more perspective of they'll get through it too. That's an important thing for all of us to do. Share with one another and support each other. I want you to know I care. I want you to know it is important to me that you continue one day at a time, one foot in front of the other. Keep making those progress steps. Don't stop. You will get there. Take care of yourself, and if you can, help take care of someone else as well. Right now, it's important for us all to help each other. Take care. I'll see you next time. Bye. When I woke up from breast augmentation, I looked at the nurse and I said, "Hey, was my reduction good? Is it all back to normal again? Is it good? Am I flat-chested one more time?" And she looked at me and said, "Don't say that."